Can you please introduce yourself and tell us what your role is in the department?
My name is Dr. Muthupi. I'm an obstetrician and gynecologist. I'm the head of Obstetrics and Gynaecology.
Can you please share with us what a day-to-day experience would look like for interns or commserves working in your department?
Our role is basically to train them. It's not to make them obstetricians out of them, but it's to make them to be safe doctors who can go and provide obstetric or gynecology care to any area of their choice once they start living here. Part of our wish is that when they finish here, they can then go and specialize and be gynecologist and obstetrician, because we need a lot of them.
You've mentioned to us before that you've worked here for 20 years and that you were one of the first group of interns to arrive at Mafikeng Provincial Hospital. Are you able to share with us what some of the differences are in the experience between then and now?
So when I arrived in 2009, then I found Dr. Kwashi sitting here. He taught me how to do a Caesar as an intern. When we were interns in 1998, there were only 5 interns in this hospital. The first group of interns to arrive in this hospital after about 4 or 5 years of absence of intern. And I happened to be the first commserv doctor. Look, the hospital has grown. When we were here, there were still departments, but each department, they had few doctors. There was 1 consultant per department. We were only 5 community service doctors in internship then. If you come today, I'm sure there are about 40 or 50 interns, about 10 or so community service doctors. The departments have grown. They admit more patients. So the workload has increased. But that's the growth of a hospital. It's expected. The moment you start looking for specialists, you expect that the quality of service that you provide must improve. The quality of outcomes that you have must improve. And the challenge that it brings to you is that the training that you must provide must also improve. So that will probably be the gaps. And one of the things that also must change within us is the attitude of work must also change. It must be geared for these particular challenges. My department is one of those departments that you must be on your toes all the time. As a trainee, as a young doctor, you just need to be on your toes, because we deal with 4 different types of patients in one. We deal with a healthy patient who comes walking and talks to you and everything is fine. In the next few minutes, this patient is screaming of pain and we think that may be normal, but in the next few hours, this patient may be critically ill in the ICU, the same patient. And this person must be looked after every hour or so until she gives birth. So that's the nature of our work. So it is quite demanding, and we tend to demand that from our interns and doctors, but it's not easy.
Can you give us one word of advice for any of the interns or commserves who are coming to work in your department?
What we require is hard work, is passion, willingness to work, your ability to translate. You need to translate from whatever department that you come from. If you're coming from 6 years straight to internship, you must translate quickly, because the job in our department, our job is too demanding, is too vigorous. You must always be on your toes. You must have the passion for the work. You must hit the ball running just when the word goes.